Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Fiorella Castillo. She's a developmental pediatric fellow. Her Kevin MD article is Advocating for Immigrant Children, a Doctor's Perspective. Fiorella, welcome to the show.
Thank you so much for having me here today. It's so nice meeting you.
All right. Thank you so much for joining us. So tell us a little bit about yourself and then tell us about the article on Kevin MD for those who didn't get a chance to read it.
Sure. So I am a third-year developmental and behavioral pediatrics fellow over at the Children's Hospital in Montefiore. And I was actually born and raised in Peru. And I moved to the US in my early teens and went straight to high school. When I arrived, I didn't speak any English, and I learned all of that here. So growing up as an immigrant in the US, I am no stranger to the health, economic, and educational disparities affecting our communities. And I became a pediatrician with the hopes to help children and their families, in particular those with developmental disabilities.
Wonderful. So tell us about your article. It's titled Advocating for Immigrant Children, a Doctor's Perspective. What's your article about?
So my article touches on what are recent events and that have created a toxic environment of fear and uncertainty for immigrant communities. We know that whether direct or indirect, interacting with the immigration system is an adverse childhood experience, and this poses developmental and socioeconomic harm to children and their families. We know that about 1 in 12 children risk losing a loved one to deportation, and this leads to long-term trauma and adversity, along with what is the related economic, educational, and social disruptions in their lives. Now, in addition to that, immigrant children face compounding developmental and personal threats, including detention in unsafe, unsanitary, and developmentally inappropriate conditions. And even what were once safe spaces, such as churches, schools, and hospitals, these are now subject to immigration activities. Now, we think of children with legal status maybe being a little bit better off, but these children still experience developmental harms which affect their mental health, as immigration status is often precarious, and sometimes this changes day by day. So this situation overall is a source of confusion, anxiety, and harmful stress to everyone. Here in the Bronx, I serve a very large immigrant community, and in my article, I discussed the case of a patient of mine with whom I was having a phone call, and all of a sudden she tells me that ICE is at her door, and in a very desperate voice, she asked me, "What do I do?" I mentioned I'm not a lawyer, I'm not a social worker, I'm a physician. And even here in our clinic, we try our best to guide and help our patients, but sometimes it's way more beyond that what we can do. So we need to partner up with organizations that can better help our communities. Recently as well, all of this situation has caused a lot of stress, even not just with our patients, but also with our providers here. As we hear, for example, not that long ago that there was a raid at a nearby high school here in the Bronx. So a lot of our staff are local, so they are thinking about their own children, and they're thinking about also the families they serve. So this is essentially what my article is discussing, and in a way to advocate for policies that lead to, we know that policies that lead to family separation and detention are developmentally harmful and need to be avoided. And we really do need systemic changes to our immigration policy to stabilize what otherwise is precarious legal statuses. And we really need high quality, culturally and linguistically responsive mental health care. This is essentially to support the well-being of the children and their families that are impacted by these issues. So this is, in a nutshell, what I talked about.
So, for those who aren't familiar with developmental pediatrics, you mentioned that interactions with immigration authorities can lead to adverse childhood events and developmental issues. So, specifically for those who aren't familiar with those, what exactly are some of the adverse events that we could see in our children?
So when we discuss adverse childhood experiences, it's experiences that can lead to what is trauma. One of them being, like, for example, death of a loved one or family separation, whether it's through divorce or other means. We talk about chronic health issues. We talk about having a parent that is in jail or being a victim of abuse, whether physical or psychological. Those are some of the examples that are comprise what is adverse childhood experiences.
And the impact of these traumas and adverse childhood experiences, they're lifelong,
Exactly,
potentially,
yes.
correct?
So when we think about the effects of adverse childhood experiences, it's not just related to what is mental health conditions. We talked about much higher risk of things like diabetes, hypertension, and other chronic health conditions, and even some, overall deterioration of health. That is not just mental health, like, for example, depression, anxiety, or fidelity even.
And you
Mhm.
mentioned, of course, that you're seeing this in your clinic in
Mhm.
the Bronx. So tell us about some of those conversations. You don't have to go into a specific one, of course,
Mhm.
protect privacy, but in
Yes.
general, what are some of those conversations like? What are some of the fears that the families are expressing to you in the exam room?
Yeah, so at the clinic here at the Children's Hospital at Montefiore, I work at the Joseph Kennedy Center Evaluation and Rehabilitation for children with developmental disabilities. And I particularly see children that ADHD and other neurodevelopmental conditions. And some of these conditions may be more severe than others, and no, there's no two children that are exactly the same. We do have children with severe impairments, and it's particularly some of those families that are the most worried, as causing something like separation can really affect their children who are severely impaired.
Hmm.
Some of the questions that I get is like, if I'm not here, who's going to take care of my child? My
Hmm.
child doesn't speak. They have severe autism, and along with that, a development an intellectual disability, and they cannot care for themselves. And I am the only caregiver. So what's going to happen to my child? Other families worry not just about the children with developmental disabilities, but also some of their siblings or other family members that may be dependent on them. So every day this conversation comes up, and it's been really, we're able to provide certain guidance in terms of how to best protect themselves and how to get everything in order. But if we're not having these conversations, then these families are really in the air. They have very little guidance and support otherwise, and they're just fearful of speaking about these issues. So we kind of become a safe space for them to get information, a trusted source of information as well. Recently, I had a patient of mine tell me, I didn't know that a few blocks down neighbor had gotten deported until I saw a for rent sign on their front
Hmm.
door. So I asked the landlord what happened to this family, and I told them they had been deported and they needed to rent a space for somebody else. So these are things that we hear every single day, essentially. And not only that, but also the raids that go on in our neighborhoods.
You mentioned some guidance that you can offer in the exam room. Tell us a little bit about that guidance in terms of what you tell patients, and what are some other specific things that you could do as a physician in the exam room. I know that you mentioned earlier about immigration policy, but I guess on a more individual level, what are some specific ways that you could support these families?
So we have developed what is essentially a listing of immigration lawyers that may provide pro bono services. And also I believe that the Immigrant Legal Resource Center has produced these red cards that have specific information about their rights, and specifically also contact information on who to reach out to when they encounter an immigration officer.
Now, how about outside the world of developmental pediatrics? Because these issues are affecting all of our patients. I'm
Mhm.
sure primary care physicians like myself in internal medicine, we don't see it as often as you do, but I'm sure that these are very common in the families that we see. Tell us about some of the things that we can do in the exam room, maybe some resources that we can share with our patients outside the world of developmental pediatrics.
Yeah, so similarly to what I mentioned, having resources ready, if a family is willing to disclose some of the information or some of their concerns about what to do in the case that they encounter, an ICE agent, or what happens when a family member gets detained. Having that information ready on next steps or who to contact based on the state that they're located will be really useful. And also letting patients know about their rights, their rights when being detained, or even their rights when, say, an immigration agent comes in and speaks with them.
In your article, you mentioned two organizations, the Immigrant Legal Resource Center and the Legal Aid Society, as options. So tell us more about those.
Yeah, so they are local community-based organizations, and they provide what is pro bono services to immigrant families, and they also cover other legal issues as well. But those has been the most in terms of supportive and vocal about working with immigration, related issues in this day and age.
So, what do you see in the foreseeable future? Because the political climate probably isn't going to change for the next few years. So, what do you see in the foreseeable future regarding this issue?
So I don't think I can speak in terms of, what specific policies that may be implemented or how this may evolve, because things have been rather unpredictable in many areas lately. But one thing that is very glaring to me is that these types of situations really affect the mental health of our
Hmm.
children,
Hmm.
whether with developmental disabilities or not. So in addition to the work that I do as a developmental pediatrician, I also study things related to school disengagement and other things related to what is literacy and LDs. And I have studied disengagement in terms of how it intersects with mental health. And just adding extra stress, like an extra adverse childhood experience, to what is an already very disengaged, school-aged children community, it will just make things much worse in terms of creating such an unstable and toxic environment. And I can see it affecting not just mental health, but also the education, and later on, as well as these children grow, they will become adults with, trauma.
Hmm.
And we will see that in terms of not just mental health, but also in other chronic conditions.
You mentioned earlier that there's also a tremendous amount of stress on the staff members as well, and your
Mhm.
colleagues and fellow
Yes.
clinicians. So talk
Mhm.
more about that and how you are supporting each other and some of the things that you could do from a mental health standpoint among the staff.
Mhm. So because of the place that we work in, we establish very deep connections with our families. These are families, and some of us also have children with developmental conditions. So we really relate and get very close to our families.
Hmm.
When we hear that, patients are struggling for these specific situations, it really also affects our mental health. So we have had here discussions, we've had a town hall, we've had debrief sessions when we do encounter, for example, families that have gotten deported. And so we're in terms of what we can do to help ourselves. We do have a very robust what is wellness initiative here at Montefiore. And also here, just how prepared we can be to help other families as, these things keep rolling out.
We're talking to Fiorella Castillo. She's a developmental pediatric fellow. Today's Kevin MD article is Advocating for Immigrant Children, a Doctor's Perspective. Fiorella, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Mhm. So, like I mentioned in the article a little bit as well, that just these policies that lead to family separation and detention are so developmentally harmful, and we really need to be avoided. We need to become what is a safe space for our families to ask, so they can have the opening to ask for support. And we need to have ready information to be able to give to them in case that they do encounter immigration or other agents on how to best support themselves. And we really need systemic changes to our immigration policy to stabilize what otherwise are precarious, legal statuses. And one thing and that I feel really strong about is just we need more what is culturally and a better quality mental health to better support the well-being of our children, not just those with developmental disabilities and those that are impacted by these immigration policies, but also those surrounding them as well. Thank
Fiorella,
you.
thank you so much for sharing your perspective and insight, and thanks again for coming on the show.
Thank you so much for having me.